big squares we'll find out and multiply. In 50 big squares they have found out 33. So heart rate is 33 into 6 is equal to 198 beats per minute. So normal intervals, now we need to identify whether the intervals are normal or not. So what is P wave duration? It is, I told you, maximum will be 3 small square, that is 0.12 seconds. So millisecond they say 120 millisecond, and PR interval maximum is 0.2 second or 200 millisecond. QRS duration is about 0.12 second or 120 millisecond. QT interval is about 0.44 second or 440 milliseconds. So we know one small square is 0.04 second. This you need to remember. One small square is 0.04 second and one big square is 0.2 second. I told you previously. So small square is 0.04 second and one big square means 5 small squares. So it is 0.2 second. So if I say that P wave should be less than 120 millisecond, so that means should not be wider than 3 small squares. And if I say normal PR interval is 0.2 seconds, so beginning of P wave to beginning of R wave should not be more than 5 small squares. So normal PR interval is between 0.12 to 0.2 second. That means from 3 to 5 small squares. Here we can see what is the PR interval here. Anyway, anyone can say, any one of you. What is the PR interval here? Beginning of P to beginning of R wave. So it is about 3 or 4 small squares. 3.5 small squares. So it is normal in between 0.1 to 0.2 second. You can see. What is the PR interval here? It is also about 0.12 or 0.14 second. So it is about 3 small square to 3.5 small squares. You can see because small squares are, if you see carefully, you can see the small squares and big squares in this ECG. Here also you can see. So here also you can see what is the. Am I audible? Hello.
Yes. Yes.
So what is the PR interval here?
3 small squares.
3 or 4? 3.5. Like that. So what is the normal PR interval? Normal PR interval is 3 to 5 small square. That is 0.12 to 0.2 second. Okay. Normal QRS duration is 0.08 to 0.12 second. এখানে 0.11 লেখা আছে, but we say that it is 0.08 to 0.12 second. That is 2 to 3 small square. 2 to 3 small squares. Whether it is 2 to 3 small square yes, it is in less than 0.3 small square. So it is QRS duration is normal. And here they are bizarre. QRS is wide, the totally QRS. You can see VT and VR, the total rhythm is also, there is no clear complexes moving in. This is ventricular tachycardia. This is VF, what is offered. So P wave normal height I have told you. Some say it is less than 3 millimeter, or some say less than 2.5 millimeter. Normal duration is less than 3. So we can say in height and width it should be less than 3 small squares. So we say P wave denotes atrial changes. P wave denotes atrial depolarization. So atrial depolarization, it will reflect the position of the atria. What will happen in left atrial enlargement? The P wave will be wide and notched. In left atrial enlargement, P wave will be wide and notched. In right atrial enlargement, P wave will be tall and peaked. Tall means more than 3 small square, and wide it should be more than 3 small square, or sometimes say more than 2.5 small square. So it should be 3 small square বেশি এবং so P wave, normally P wave is left atrial enlargement, mainly occurs in diseases of the mitral valve. So sometimes we call P mitrally, and right atrial enlargement occurs due to problem with the lungs or pulmonary circulation. So we call P mitral or P pulmonal. P pulmonal means right atrial enlargement, and P mitral is left atrial enlargement. Now we'll see how this does look. PR interval. PR interval. We have told this. We are talking about P wave. P wave. P wave always positive in lead 1 and lead 2, always negative in lead AVR. If we see this, then this is, they have shown that beautifully. There's less than small square in duration and less than 2.5 small square in amplitude or height. Commonly biphasic P wave is seen in V1, base seen is lead 2 and V1. So P waves are base seen in lead 2 and V1. So atrial abnormalities, I told you, will be seen. So if there is left atrial enlargement, you go to the right hand side of the picture. This picture is extreme right. What will occur? Wide notched. You can see wide and notched. And in case of in V1, this will be looked into lead 2. Lead 2, there will be wide notched, and lead V1, the negative complex will be more, and it will be more than 1, and the width of the P wave should be more than 3 small square. And in case of right atrial enlargement, it will be in lead 2, the top mark in the picture. Pointer option, pointer option, highlighter. So you can see this is left atrial enlargement. So left atrial enlargement, what will happen in lead 2? This is lead 2 and this is lead V1. It will be wide and notched, and in V1 it will be more negative complex. Now in right atrial enlargement, what will be there? Right atrial enlargement. What will be there? Tall P wave in lead 2, and the positive deflection will be more in lead V1. So look at this ECG. I told you P waves are best seen in lead 2 and V1. In lead 2, you can see tall peaked P wave. Can you appreciate there is tall peaked P wave in lead 2? Tall, more than 2.5 millimeter and pointed P. So this is called right atrial enlargement or P pulmonary. And in lead V1, the positive deflection is more. You can see the more. The upper part is more. It is also wide and upper part is more. And right atrial enlargement, here also you can see the P waves are tall, especially in lead 2, 3 and AV wave. And in V1, the V1 we say there is biphasic P wave and the positive deflection will be more in right atrial enlargement. So what will happen in left atrial enlargement? Notched bifid hemipsed P wave. This is P mitral. Here you can see what is this? This is lead 2. Hmm? Lead 2. And this is lead V1. So in lead 2, what will happen? Wide notched P wave. Can you appreciate? And lead V1, there will be negative deflection will be more. So here you can see in this ECG, the lead 2, there will be wide notched P wave. So it is left atrial enlargement. And in V1, there is wide and negative deflection mode. That is in V1, the left atrial enlargement. Here another pathology is there. Can you tell me what is the PR interval here? From P beginning of the P wave to beginning of the R wave. Can anyone tell me the PR interval here?
6 to 7 small boxes মতো আছে।
So it is normal.
না,
Is it
abnormal
normal?
increased
It is
PR
normal. It
interval.
is increased. So it's normal is between 0.12 second to 0.2 second. So it is more than 0.2 seconds. So we say prolonged PR. Prolonged PR occurs in first degree AB block, first degree heart block. So you have learnt about left atrial and right atrial enlargement. PR interval, we have said PR interval start of P waves to start of QRS, 0.12 to 0.2 second. More than 0.2 second is first degree AV block. And QRS complex total duration is less than 0.1 second, less than 2.5 second. More than 3 small square is intraventricular conduction defect. So if the QRS is wide, interventricular conduction defects occurred. It can be a left bundle branch block, that is M pattern in V5 and V6. L means left, and leftward leads are V5, V6. If we remember that picture, V5, V6 looks at the heart from left side. So if there are changes in the left ventricle, left ventricular hypertrophy, in which leads we will find? Left ventricular hypertrophy will find changes in the V5 and V6, and right ventricular hypertrophy will find changes in the V1 and V2. It's simple, nothing to be complex, nothing to be mugging of. So if you can remember this anatomy, V5, V6 looks at the heart from the left side. So any changes in the left ventricular size, left ventricular hypertrophy means left ventricular wall hypertrophies, increases in size. So that change will occur in V5, V6, and right ventricular hypertrophy changes will occur in V1 and V2. So what changes we are talking about? We are talking about these changes in QRS complex. The left bundle branch block, M pattern QRS more than 0.12 second, and right bundle branch block RS addas pattern in V1. So we will see these changes, what will occur. So we were talking about normal PR interval. Long PR is first degree AV block we have shown, and short PR is occurs in WPW syndrome. It's called Wolff-Parkinson-White syndrome. The long PR, you can appreciate here. What is the PR interval here? It's about 7 small square, that is 7 into 0.04, that is 0.28 or 280 millisecond. And in the lower picture, 5, it is about 8 small square, so 0.32 second. So first degree AB block, clearly there is prolonged PR interval. PR interval is more than 0.2. That means first degree AB block. Now short PR interval. Can you appreciate here the short PR interval? Here the PR interval less than 2 small square. Can you see the P just appearing just before the, in lead 1 you can appreciate more. In lead 1 if you see just before the QRS wave, and if you see the in lead 1, if you see that there is slurring of the upstroke, we call it delta wave. If you see here, if you see here, there is slurring of the slurring. It is not straight line. Slurring of the upstroke in the R wave. It is called the delta wave. So delta waves and short PR interval are characteristic of WPW syndrome. WPW syndrome. Now QRS interval, what I was telling, the bundle branch block. Conduction in the bundle branches and Purkinje fibers are seen as QRS complex on the ECG. Therefore, a conduction block of the bundle branches would be reflected as a change in the QRS complex. The right bundle branch block from the right side, whether when entering through to the left heart and going to have its branches as Purkinje fibers. So right bundle branch block, if it occurs, we know that right looks at the heart from the B1, B2, and though then it will appear as this is one R wave and another R wave. So we call it RS Addas pattern. The QRS will be wide and there will be two R waves. So one, if we say one is R, we have to name another R as R dash. So this kind of wave should be seen, and it is wide. So it will be bundle branch block, interventricular conduction defect is there, and it will be seen in the V1 leads. So bundle branch block, you can see the RBB, what will happen in V1. RBBB and V1, and this is the V6. So in V1 we will have RBB RS test pattern, and V6 we will have tall R and deep S wave. Got my point? And what will happen in LBBB? LBB, it will look hard from the left side. So in LBB, what we'll see? M pattern. M in V5, V6, and downward M will be in the V1. So in RBB, RS test pattern in V1 and LBB, M pattern in V5, V6. This M separate. For RBB, the wide QRS complex assume a unique virtually diagnostic shape in those leads overlike the right ventricle, that is V1 and V2. You can jolly well see in this ECG, this is ECG of a person who has right bundle branch block. So RS dash pattern can be appreciated here. Here we can jolly well appreciate this RS dash pattern, one R, then another R. Got my point? In V1 as well as V2 and V3, right sided leads. Clear? The QRS is wide. It is more than 0.12 second, more than 3 small squares, and RS dash pattern can be seen. Late bundle branch block. For LBB, the wide QRS complex assume a characteristic change in shape in those leads opposite to the left ventricle, and broad deep S waves will be seen in case of B in B1, and if we go from B1 to B6, we will find what? M pattern in V5, V6. So this is V5, V6. We can jolly well appreciate this M pattern. You can jolly well see the M pattern, V5 and V6. Can you appreciate? We can also appreciate in it in 1 and AVL. 1 because they are also left-sided leads, 1 in AVL. So there will be wide wide QRS is about more than 0.12 second, more than 0.3 small squares, and it is M pad, looks like M. And in V1, V2, what we will see? We'll have deep S waves, deep S waves. And the QRS is wide. We can also see in the 1 and AVL because they also looks at the heart from the left side. So till now, what we have learned about? We have learned about the ECG machine. We have learned about how to look at the ECG. We have seen the calibration, how calibration is done. Can you appreciate the calibration is 1 millivolt or in small square? We have seen the precordial leads, the positioning of the leads, and the normal ECG, what we need to find out in a normal ECG, we need to tell about these points. The standardization, calibration was there or not, the rhythm, the rate, the PR interval, the QRS interval, the QTQ interval or QTC, corrected QT, the mean QRS axis, the P waves, the QRS voltage, the progression of R wave, abnormal Q waves, ST segments. Now we have discussed till QRS interval. In the next class, we will discuss for others. Please stop the recording.